In case you haven't heard, America's medical industry is pretty effed, but it doesn't have to be. Welcome to Right to the Root. I'm your host, Stephanie Wright, and I've built my career on helping practices reach their full potential. Join us as we dig down to the root of the insurance industry's most complex problems and how we might be able to turn it all around.
Today, we have Dr. Susan Maples, who is an amazingly impressive doctor. She focuses her practice on total health dentistry, but she doesn't just practice it. She also is a nationwide speaker and author, and just an incredibly long list of so much she does for dentistry. And so, Susan, thank you so much for being here and agreeing to come on my first season for the podcast.
Congratulations on that.
Yeah, I'm really excited because it was really evident in 2023, Delta Dental served me a cease and desist. And it was for my work of having practices insurance independent, such as yours. And they tried to silence me and bully me because they have a lot of big money to be able to do that. And what that did was it did cancel some of my dental association meetings because licensed doctors are part of it. And we can't have this big group of people talking against the insurance company. So there's a lot of fear. And this podcast was really kind of born from that. How can I get my voice out there? And they see me as such a threat because of the way I'm able to educate my clients, to educate their patients, for their patients to also kind of bite back as well too. And so this podcast is really surrounded of incredible people like yourselves, and how the insurance, the negative effects of it, how is it that insurance today prevents, and even 24 years ago when you're like the pioneer on this, prevents total health dentistry?
What is your primary motivation, Stephanie, with your life's work and your podcast? If you could put that in a nutshell, what is it you hope people will have a sense of after you've completed your career?
Yes. I started out as a registered dental assistant, and I quickly realized that there was a lack of communication systems and cultures in practice. As a Coast Guard veteran and a handful of different educational pieces, I really moved into the administrative side of things and then management. And it came down from one doctor referring me to another that I decided to start my own company. And I focus on building up that culture, the technology. How do we become very efficient with the technology at our fingertips that a lot of people are scared of? And then obviously, how do we navigate this wild insurance world? It didn't originally start removing that participation because that's kind of scary. It really started with not accepting no for an answer.
I'm just super curious that if we were to say about you after your career is completed, here's what she did, here's what she stood for, what would that look like?
Erin Brockovich of insurance.
I love that.
Yeah.
If anyone listening has not seen the movie Erin Brockovich or seen it a second time in today's world, see it.
I'm pretty excited. I've already done some travels to other countries because our insurance system is definitely not working. And I'm not saying that there's perfect ones around the world, but we have to be exposed to it. And not everybody can fly around everywhere. And so I want to talk to incredible doctors like yourself here across the nation, across dentistry and medical, and do the same worldwide and try to help and discover how can we fix or move in the direction of fixing what we have going on right now.
Well, when 1980, before dental school, I spent a semester in Paris. I grew up a sick kid and bucked the healthcare system and already knew the system was broken. And I went to Paris to study the French social security system, is what they called healthcare there, and came back feeling like, well, they don't have the answers either. So you're absolutely right. We haven't figured out a way. And if you're going to ask me, my bias is much more toward prevention. This is a global systemic problem in all of our issues. We tend to react to issues rather than be proactive. And in healthcare, this mimics everything else. It mimics we're doing with our land, what we're doing with our air, what we're doing. I mean, but healthcare, more importantly, because we have a major healthcare crisis and the financing of that is unbelievable. And we now know the evidence is clear that 85% of what we're paying for in healthcare is preventable.
Yeah.
Means if we focused on prevention, we would not have a healthcare crisis. Unfortunately, only 1% of the dollars we spend in today's world are for preventive services or strategies. 1%. That therein lies the issue.
It's alarming. I just had an interview this morning with a few doctors that worked for Trinity Health, medical doctors, and not in dentistry. And they have a concierge care that is focused like completely on that. It's unlimited visits, telehealth, and without the restraints of this big privatized network, removing your autonomy of care. And it was an incredible experience to be able to, right from day one, build that relationship and then learn so much more about it, because comprehensive preventative care, it would save this country so much money.
There are a lot of problems with that. I mean, in terms of patient engagement and mindset, our culture again leans toward reactive rather than proactive. It's seeped through to people. So most people are driven by the mindset that if they don't have a problem, they don't need help. So even if there is access to it, there may be a lack of awareness, motivation, or even perceived necessity toward it. You are talking about one aspect right now, which is the insurance reimbursement. But I also believe patients have a part in this.
Yes.
If it's offered, do they take it? I also know that healthcare professionals have a part in it. There is such an emphasis, especially in not just in managed care, like publicly funded programs, but by all of the all of the corporate dental offices. There's such a focus on profitability and efficiency that there is a perceived lack of time to work with people on lifestyle-related change that might prevent certain things. And we don't get reimbursed for that. And we don't have the skills necessary. And if you look at all of the educational offerings, for instance, at the upcoming Chicago Midwinter, very few offerings on how do we help people move healthcare or health change behavior into the forefront of their minds and convince them that these small steps will make a big difference in the long run, not just in terms of their bank account, but their overall well-being, right?
It's absolutely true. Everything is, dentistry for so long is certainly like it has more of reactive care. Medical definitely does, but dentistry. And now as we're learning about it in regards to periodontal disease, in the last decades, it's come out as far as like what that's associated with dementia, heart disease, so many things. However, the part as well is the quality of life. If somebody doesn't have teeth, they can't smile. And so it's how do we get in front of people to educate them outside of just some podcasts here that we have to like fingers crossed everybody listens. But what do you think it would be a great solution to start like from birth to like really hammer that in?
Well, it's interesting you say that because I wanted to challenge your thinking. You had mentioned in our text thread that we had going about insurance companies giving pushback on paying for SRP, scaling and root planing, and things like that. Let me ask you, just overall, name me 5 areas of prevention that you can think of that are covered by insurances in medicine or dentistry.
Yeah. So your annual exams that you have, nothing generally outside of that. They may decrease that and have co-payments. Your testing in laboratories within your medical doctor's office, the prophylaxis that you provide there. For women, a breast cancer screening and OB visit. And then Sunday.
Stop you.
Sorry.
I stopped you at 4. Let me just take each of those. First of all, when I did the research on blabbermouth, the blabbermouth 77 secrets only your mouth can tell you to live a healthier, happier, sexier life. It's an evidence-based book on oral and systemic health for adults. And I found out that people who get annual exams have more diagnosed health problems and more medications and are not considered healthier than those that don't. So the evidence does not promote exams, which is crazy. In Canada, they're not even paying for preventive exams anymore. Problem focused only.
Okay.
So where we're going. I will tell you that you talked about blood work. Are we testing the right things? Or are we testing a very wide parameters of like wacko things and things that fall really aberrantly out of the norm? Or are we really dialing in health? How many of us are looking at our vitamin D, our magnesium, our B12, our inflammatory panel, things that could give us a clue that we might be a little off, rather than waiting until just something flies really weirdly off the radar, like your liver functions way off or something. And then you mentioned mammograms. So I'm thinking colonoscopies and mammograms and PSA tests. Are those prevention?
Oh, no, I have my own story on that.
Yeah. Are they early detection?
Yeah.
The early detection, which means we know we have better outcomes when we can catch cancer early. But what would it take for us to actually prevent cancer rather than just focused on early detection strategies?
I'll share my personal story with breast cancer. Ashkenazi Jewish woman and the lineage of female breast cancer in my family. And so since 30, high risk. I would get my mammograms. I would be asked as well too if I will pay for the 3D one because of dense breast tissue. Mm-hmm. And in 2021, in February, they found a mass on my right side. It was benign, but it had precancer indicators. So they put a clip in there and watch it. And I said, why? Why are we going to wait for it to turn into cancer, right? We already know how high risk I am. Prophylactic breast removal. I'm not doing this out of just nowhere.
You had genetic testing, right? And
in 18 months later, because I pushed to have MRIs in the rotation, which is like really the best type for detection that you can find and very early, they found 2 different types of cancers on my left side. And it was so far into my breast tissue, into like my armpit, the oncologist has said I would have had it for 2-3 years before it was found.
So did you do a double mastectomy then?
I did. Yeah, I absolutely did. They wanted me to do radiation and I refused it.
Oh, that's real prevention, right? But, waiting for early detection is sort of like counseling people on that's obviously a small, genetics is a small part of our overall global disease management problem, right? They consider that about 5% of the problem. But that's such an interesting story. I love it.
Yeah, the chronic care like that. I mean, that's why radiation was pushed on me. That's moneymaker for the hospitals, right?
Yep.
And it's really quite crooked. And even recently, I feel like I keep on saying the universe gives me more content that is specific to me because I had a iron infusion and I went in and they gave me the test stuff that is highly reactive. And they had said, if anything feels different, you have like itchiness or maybe cloudy eyes or anything other than how you feel right now, you have to let us know because your insurance won't pay for what you were actually prescribed. So sure enough, within moments of them starting the infusion for the test amount, I started having this deep ear itch. And so they all raced around me after I pressed the button, turned it all off, and I had to go back. So there was 2 hours out of my time that I have to go back. But again, my insurance plan had decided to gamble with life to save money. And then here we go. Now it's costing more money. Like, why are we not focusing on the preventive aspect of it? I don't understand. Why are we cutting corners?
There are lots of reasons. Again, insurance companies tend to be very short-sighted. They prioritize short-term financial performance and profitability. Again, they're hesitant to invest in preventive measures. Partly because they don't see immediate returns. We're a very short-focused society. If we don't see immediate returns financially in this quarter, in this year, we can't measure it. And so that's well, if you were running a company, you would have to report to your stockholders. This is all that we can't say that. Gosh, if we could prevent this, just imagine how much we'd save 20 years from now. Nobody is saying that.
Mm-mm.
So I want to go on. I want to go on to specifics of dentistry because I know that our listeners are more interested in how it impacts them day to day.
Absolutely.
And what they can do to maybe move away from reliance on third-party payers, or at least signing all those contracts. And I think that is the more difficult challenge. You could be as angry as you want, but if you're not in a position to become a non-par dentist, non-participating dentist, or you would lose your practice, then you're just going to sit around and be frustrated your whole life. How do you get there? But I wanted to kind of address the issue you brought up on SRP and getting denied and things like that. What was your question?
So I feel as though something like periodontal care, especially because I'm in dentistry, right? And I'm not the public that thinks it's just a deep cleaning. I know how much more is involved in it. And why is that not considered part of this, comprehensive plan, preventative plan? Because we all know it will lead to periodontal disease. It leads to dementia and heart disease as well too. And so the denials that are there is bizarre, and saying that it's not medical necessary when they've never met the patient.
So I completely agree that combating periodontal disease can reduce the risk factors for heart disease, dementia, stroke, preeclampsia, early birth weight, the list goes on and on and on. Chronic systemic inflammation, all of that. But if you just take SRP, scaling and root planing for periodontal disease, is SRP, are you thinking it's preventive?
No, it is treating it. It's already there and active. But right. I do believe that preventing it from progressing, and I'm not saying that that's the end all. There's a lot more that goes into it between somebody's lifestyle and diet as well too.
And if you were a betting person, and I said to you, put your money at where your mouth is. Give me a bet. How much of that SRP that we're doing in dental offices really does arrest the disease?
Man, that is really a great question. Because I wasn't a dental hygienist as well too, that one is a little bit on the challenging side.
But you were in a dental office for many years.
Yeah.
You hear the challenges.
Yeah, I would have to believe 50% or less, because we have to deal with so much more than just somebody going in. So we have to rely on a diet and lifestyle change, depending on those different factors that we have there as well too. And overall look at the patient as far as, are they on medications that are causing dry mouth and exacerbating that as well too. And then they have to stay on the frequency for which they've identified to keep it and arrest that.
So, I'm probably a little jaded, but I would guess it's probably 5%.
Really?
Yeah, I would say scraping shit off teeth just doesn't work. Flat out doesn't work. And we find ourselves on the peri-go-round, where we may see some immediate results, and then 3-4 months later, 6 months later, we might say to them, gosh, you're really having some bleeding here and there. I really want you to make sure you're doing what we talked about. And then 6 months after that, we're already thinking about how do we talk them into going through it again? Because
that's a big one.
Well,
it's not
if it didn't work to begin with, is this one of those, let's repeat the same thing and expect different results?
Yeah.
I call it the peri-go-round.
Yeah.
I believe it's because we aren't looking at the root cause. We aren't looking at the bacteria present. So unless you're assaying the bugs and know what we're going after and treating the bugs, not just the crap, not just the ledges, you cannot tackle periodontal disease with a sharp instrument. You just can't do it. But I also believe that skill building and habit development are very important. that does not come with SRP.
No.
And we have sidelined that, I will tell you, by trying to become more efficient. Much of the SRP is happening like an hour one day and an hour the next.
Yeah.
So 2 hours for 4 quadrants. Where is the skill building and habit formation? The other aspect of it is all the systemic factors. Who is addressing the dry mouth, the candida infection that's mostly invisible? Who's addressing the nutritional deficiencies? If you've got a systemic disease, you need good nutrition, you need hydration, you need sleep to settle all this. You went through your surgery to heal from that. You got to treat your body like a temple. You can't be out partying like a rock star and eating crap out of a box bag and, drinking coffee and then going
water.
Right. But the point I'm making is that when we look at all of the, I'm a little biased as a past president of the American Academy for Oral and Systemic Health. I see periodontal disease very differently. To me, this is not a mechanical thing. So I am not privy to what statistics the insurance companies are looking at when they deny coverage, but I am certain that SRP is not what you think it is.
Low line.
Well, and again, we do SRP in conjunction to all this. We do what we call perio bundling. We're not finished until white tight gums and a microbial profile that matches the future of health for that person. If you're not assaying the bugs, you don't know. And during that time, we're addressing all aspects because you can't change the microbial profile of mouth without restoring some saliva. Then you have to look at, well, what medications are causing that? Maybe they're smoking marijuana or doing a gummy before bedtime. Like there's a whole bunch of medications. Dry mouth, there's all kinds of issues, right? So it is a very complicated disease. And I'm not trying to speak up for the insurance companies. I think it's a travesty that, listen, Delta Dental has their monstrosity of an empire right by my home, and they have fishing ponds and outdoor running tracks and like security systems, marble counters. Like you can't believe that this quote nonprofit company. It's a travesty. I always look at it and go, that money belongs in patients' mouths. But
it does.
I know. So I don't believe me. I am not a fan.
Right.
I am here to tell you that we can throw stones all we like. Do you know that there's no efficacy in polishing teeth?
This is actually something I've been learning a little bit more of as well, too, very, very recently on it. But I think it's one of those things that patients expect to have happen at each one of them. So it's like, carry on.
Right. And we do it. And the insurance companies go to the bargaining table with representatives of the employees and they fight for their benefits and they don't want to change that. We like paying for prophies, rubber cup prophies for kids probably shouldn't be done, but they do it. And they do it because people expect it rather than saying, what can we do instead? Because to truly prevent periodontal disease, we need to work with children on nutrition, on home care, on effective skill building, on habit formation. And that does not mean getting a child in for a half an hour, rubbing some rubber cup pumice on their teeth, throwing a toothbrush in the bag, and painting some fluoride varnish. That is not how it's done.
I completely agree.
It's our fault. So again, I think we all take some part in this preventive paradigm shift in doing things differently.
Yeah, we absolutely do. And as you're talking about just the different testing that we can do to make sure, and on top of it, that's customizing the care for the patient when we're looking into something so much more significant and broad. And the ADA has a pretty large set of different codes for things like testing, yet they don't recognize it as a covered benefit. What do you have to really say about that?
So to rephrase the question, what is
So how do you feel about the ADA having available codes for testing like HbA1c? There's quite a bit of testing available out there, but they don't recognize that as care. It's often an excluded benefit, or they say it's part of the exam.
Well, the ADA can come up with any code they want. And by the way, I love that they're making efforts. I freaking love our new president, Brett Kessler, who is a big oral systemic fan. Today, in fact, there's a big article that's going to be on the back cover of, oh shoot, let me look it up because
Well, let me know.
Pardon me?
They said you'll definitely have to let me know what the.
Oh yeah, it's awesome. It is going to be on. It's called America's Wellbeing Depends on Oral Health. It's written by Brett Kessler. It's on the very back page of Section 1 on the Washington Post coming out today.
I love this.
And so we're making some strides. But in terms of codes, we can have any codes we want. You can make up codes in your own dental office, but getting to pay for them are different. These are actuarial risks that they develop. And as you know, each employer buys a different grade of insurance. So even among Delta Dental, it's not all Delta Dental policies pay on the same things. They, depending on what your employer chose, thousands of ways responsibility there also. But this is a red tape mucky issue. Mm-hmm. And I am, I'm frustrated by it. Let me tell you, I feel so bad for my patients. When their insurance is given to them, most of them aren't paying for it. Some of them are paying partly for it. Yeah. And then they go to file a claim for something and they don't cover it. And it's like, wow, that's not very nice. And what would you say to the patient? I don't say, talk to your insurance company. We can do that for them. I say, talk to your employer representative.
Yes.
Oftentimes they have a choice about what policy, and they aren't hearing that feedback about policy is falling short of what we need. And, I'd love for you to represent us when you're talking to leadership.
Yeah, I absolutely, with my clients, I have them identify and let them know this is something you need to take to your HR department. This is something, because they're not medical professionals or dental professionals that are choosing these plan benefits. They're making what is going to cost save.
And like, rest assured, medical and dental are two. We don't.
Yes, patients generally don't know the difference, and it's two different ones.
It's the opposite, right? One, in medical, you pay a deductible and then everything is covered after that. And in dentistry, the little amount that it gets paid up front, and then you pay for everything. So it's the opposite, right? But what I have come to realize with patients is they don't have a clear understanding of what that is and how that money hasn't really changed over since like 1973.
I know.
Was the limit. But there's a reason for that. Our healthcare costs continue to climb. And the focus has been on trying to keep people insured in the rising healthcare cost climate. Dentistry is not even really recognized as part of that oral health fabric.
Which is interesting because that's in other countries.
It is, but it's also combined with medicine. It wasn't until the late 1700s that we literally took the mouth out of the body. It's when we assigned systems to the body, and the cardiologist went to the heart, and the nephrologist went to the kidneys, went to the nephrologist, the skin went to the dermatologist. The mouth went to the dentist, and it was in another whole section of learning. And it was eliminated from the mouth. But to put the mouth back in the body means that dentists would be covered on the same universal healthcare system as Medicare and Medicaid and all of the rest. And most dentists would not be happy about that either.
Yeah.
We really want to stay separate from medicine for financial reasons.
Yeah.
You kind of can't have it both ways.
Yeah.
Put the mouth back in the body and the mouth becomes an integral system to health. We unfortunately have to play the same game of population health that medicine's playing.
Yeah, it's really hard, and I know firsthand in regards to the negative effects and it's just not a sustainable model with things like Medicaid or Medicare. You have such a huge volume of patients in that unfortunately, it's not all about money, but we have to grow. We have team members that want more. We have inflation for products and care for these patients. And so that's a system that hasn't moved in a long time. I have mixed feelings because we know oral health affects the whole body as well too. And most patients have no idea that their dental plan is different than their medical plan as well. So we have that problem right there. And then we keep going down the line and list as well is this extraction of that $1,000 from 1973 it's maybe $1,200-$1,500 is what it's averaging now. And we go off from that. Now we add in there the education that doctors have to have. It's rose, I think it was 80 or 90% since 2010 for how much the doctors are coming out with debt, right? So we're like making this balance. And now we have patients that get $1,200 and then they have to pay for everything. Yet we haven't educated them on the importance that you need to continue on with that. And so when we look at the health insurance aspect of it, there's not like a maximum per se. Right. Well, there just isn't. I don't know why I said per se, but there's not this maximum amount, right? Yes, they have an out-of-pocket maximum. They have these larger deductibles. But what do you feel that would look like if it was all underneath a Medicare for all?
I don't know. The system is so, I mean, part of me wishes that I could be on health policy committees for the country and try to help think through some of that. Because I do have I have an ability to look at this from all sides. On the other hand, I think it is a conundrum. I know I would be frustrated. I would also be frustrated by the bureaucracy and the lack of change and when things don't make sense. I don't know that you and I can figure that. You mentioned you just slid in there, the cost of dental education. Well, the cost of goods in general. The cost of technology that's expected of us. I mean, you mentioned you do some charitable work as well. I'm going to Kenya in a month to work on kids in an extraction clinic without any water and any electricity. So basically we're just using Cava wipes to wipe instruments and going to the next child. Well, when I started in dentistry in 1985, when I bought a practice, we didn't wear gloves. We didn't autoclave hand pieces. We didn't change burrs. I mean, this was common. And then, of course, that all kind of came with the HIV era. And I'm not saying that that's not good, but OSHA is, I mean, just the amount of stuff we have to purchase to wrap our stuff in and put it in bags and throw all that stuff away in the landfill and do all that sterilization. And then the technology of the all the electronic equipment that we have, everything is computer-based and you're paying for subscriptions on all of that, from your CBCT to your scanner to your, printer, all of that, right? So it's a new world and it gets more and more expensive and patients need to pay for it and insurance companies don't want, it's just it's going to be a continual frustration. To me, my focus is not on this, and I love that yours is, and I feel your passion. Mine is, how do we, you and I, promote health in ourselves and others such that we can avoid care? Really focus on prevention and root cause and not have to receive this expensive care that is so unaffordable. Are we frozen?
Oh, yep. You know what? I guess it was on my end. I saw that you had froze and there was just a blip in my connection. So
I missed that or not, but that's really my focus is how do we, on a grassroots effort, assist our patients, since they're the only time, in all of healthcare, the last bastion of prevention belongs to a dental office.
Yeah.
People presumably book an hour appointment every 6 months, like it or not, presumably healthy, to get their teeth presumably cleaned. And we have an hour to talk to people. That's, the healthcare the medical community has an average of 13-minute visits, 7 minutes face-to-face. And they can't have conversations that might move the patient toward health. And so to me, I believe I'm happy we are where we are. And I love taking advantage of the goal in our practice, the total health practice, is to try to help every patient take one step further toward their health goals every visit.
Yeah,
Well, that deserves a conversation, not a scraping.
absolutely.
So you're really uncovering and tracking and making sure they're surrounded by the right healthcare team and playing matchmaker for physicians that aren't working out well for them and trying to get their copies of the results and help them interpret it, help them resource books and articles to support what they're trying to do. And by doing that, of course, we attract people who value health.
Yeah.
Which are the same people that pay out of pocket and don't mind paying out of pocket a little more because we're now. So instead of, my practice, instead of treating massively diseased people, we're tending to focus on people. We're attracting people who value health, which typically they have less dental disease, not none for sure, but less. They're not coming in with rampant decay and rampant fistulating periodontal disease. And, now that doesn't mean that I don't love train wreck dentistry. I do, but
Everyone does. Isn't that weird in dentistry? Just got to have that challenging case.
Right. Yeah.
What a great episode with Dr. Susan Maples. Stay tuned because we continue this conversation and we're really diving down into the root of the medical problems and not just the Band-Aids that we put on them.